Okay. Hand hygiene. Okay. Okay, my name is Antonio Lopez, and I will be your nurse today. I will be your student nurse today. Can you tell me your first and last name?
Alexis Lopez, July 15, 1995.
Okay, how would you like to be addressed today?
Alexis.
Okay, Alexis. Today we'll be performing a head-to-toe assessment. It will require me to perform tasks on certain body systems, on specific body systems of your body, consisting of the head, the torso, the abdomen, and your extremities. Okay. This assessment will require physical like skills. Right?
Patient assessment.
All right. This assessment will require you to perform physical movements with the skills. Do I have your consent to perform this head-to-toe assessment?
Yes.
Okay. Do you have any problems with your hearing, vision, or verbal or speech?
No.
Okay. And do you have any pain today?
No, not at the moment.
Okay. I will now assess your vital signs. So if you could stick your hand out for me, and then I will slide this blood pressure monitor to assess your blood pressure. In a clinical setting, this would be aligned with the heart elevation. While the blood pressure is being conducted, I will assess pulse on the other side of the arm, while also assessing respiratory rate. Okay. So pulse is 60, respiratory rate is 20, and blood pressure is still assessing. Patient's skin is noted to be pink, dry, no lesions detected yet. Okay. Blood pressure is 153/84. Okay. So now we will now begin hand hygiene. We will now begin inspecting the client's scalp. Okay. We are assessing for any lesions, any abnormal findings along the scalp. Okay, I am assessing the patient's neck, palpating the spine. Okay. Skin is intact. Moles are less than 1 millimeter or diameter. Okay, I will now assess your ears. Tell me if you are you experiencing any pain in your ears or tenderness?
None.
Okay, so I'm folding the ears, palpating the ears, touching the ear canal. Okay, doing the same for the other ear. Okay. No tenderness noted on my side. Patient reports no pain on the ears. I will now inspect the patient's ear. Okay, cerebellum noted. Or how do you say it? Cerebral?
I don't just say
Your what?
my ear canal intact.
Ear canal intact. Okay. Scalp, neck, ears. Okay. What else we could do? Okay, we'll do. Okay, I will now begin palpating the patient's sinuses for any inflammation or swelling. Okay. No sinuses are non-inflamed. Okay. Okay, I will now begin assessing the patient for his, how do you say this? Temporal mandibular joint. So I will ask the patient if he could open his jaw, close his jaw, clench the jaw, and move it side to side. Okay. Skin is oily, pink, and warm. No fever detected. Okay. Can you close your eyes for me? Can you squeeze your eyes shut? Okay. Push your eyebrows up. Um, push your eyebrows up. What was that first one?
Cheeks.
Oh, cheeks. Can you puff out your cheeks? Can you smile? Okay.
Your tongue.
Tongue. Can you stick out your tongue for me? Oh, I'm gonna do that one first. Okay. Okay. Can you breathe out through one nose? Okay. Any discomfort while doing this?
Mm-hmm.
Okay. Senses. Okay. I think I'm gonna jump to the mouth now. Okay. We'll now begin inspecting the patient's mouth. Can you open your mouth for me? Okay. Mucosa is pink. No lesions detected. No inflammation detected. Dental hygiene. Okay. Okay. Can you stick out your tongue? Can you move it to the left, to the right? Okay. Can you say ah? Can you say like dynamite?
Light dynamite. Light type dynamite.
Light type dynamite. Yes. Can we close the skin?
Nose.
Nose.
The nose.
Oh yeah. Okay, I will assess the patient's nose with the light. Okay. Sinus is intact. Okay. And then we will now perform the eye assessment. So I will ask the patient to look at my nose, and I will shine the light on them to detect the presence of glees, or
Corneal light reflex.
corneal light reflex. Okay, look at my nose. Okay. Okay. Okay, and then I will ask the patient to look at an extremity at the corner while shining the light on his pupils. Okay. Okay. Now look at my finger. Okay. Okay. Okay, now the patient will. Okay, so follow my finger while keeping your head steady. Okay, now close one of your eyes. Okay, we are now going to test your peripheral vision. So I want you to look at my nose and tell me how many fingers I'm holding up.
2.
Okay.
3.
Okay.
4.
Okay, now the other side.
2.
Okay.
3.
Okay.
1.
Okay, good. Eyes, ears, hair. Okay, now we're going to move on to the lymph nodes. We will now begin performing the assessment of the lymph nodes to detect any palpable lymph nodes. So no swelling should be noted. So this is So we're going to start with the occipital nodes, the lymph nodes. And then we're going to go pre-auricular lymph nodes, post-auricular lymph nodes, post-cervical lymph nodes, pre-cervical lymph nodes, anterior lymph nodes, okay, tonsillar, submandible, submandibular, submental. Okay, we'll now. Okay, so 1, 2, 3, 4, 5. Okay, and then we will now do supraclavicular lymph node and infraclavicular lymph node. Okay. Now we will assess the patient's swallowing. So can you swallow for me? Okay. Did you feel any discomfort with that? Okay. Trachea is being palpated. Okay. Now the thyroid gland will be palpated. Okay. No inflammation or swelling noted in the thyroid gland. Okay. I will now auscultate for bruits. I will now auscultate for bruits in the carotid artery. Okay, no bruit detected. Okay, no bruit detected on either sides. I should go for the top. Okay, shoulders. Okay, let's go to the back. Okay, we'll now be performing. Oh no, okay, we're gonna do the chest next, or? Okay. Okay, we'll now begin inspecting the patient's anterior torso and posterior torso. So, with inspection, I will ask the patient to take a deep breath. Okay, and exhale. Symmetry is noted across the chest. Do you have any respiratory distension? Okay. Patient reports no respiratory difficulties. Chest is symmetrical.
Interior lateral?
Anterior lateral, yeah. Right, okay. Anterior lateral symmetrical. Okay. And then, okay, I will now perform auscultation of the lung sounds. Okay, if the patient is not already in a gown, we will ask the patient to wear a gown for privacy. So we will begin auscultating over the gown. Please take a deep breath for me. Okay, deep breath. Deep breath. Breath. Okay, deep breath. Deep breath. Okay, we'll now move to the posterior surface of the assessment. So I am inspecting the neck. I am inspecting symmetry on the chest of the patient posterior. No abnormality seen. Okay, we'll auscultate the patient's posterior lung sounds. Okay. Okay. Breathe in for me. Okay, breathe in. Breathe in. Breathe in. Okay, we'll now begin percussing the. Okay, 99. Okay, yes. Oh, we'll continue auscultating while having the patient say 99 to auscultate for the resonance. So can you say 99 for me?
99. 99. 99. 99. 99. 99.
Okay. Okay, so 99. Okay, I think it's time for percussion. So we'll now begin percussing for fluid in the lungs. Okay, so scapula is dull. No hyperresonance noted. Okay, I will. Please let me know if you have any discomfort or pain while I am percussing your back. Okay. That should be it. Shoulders. Okay. I will ask the patient to push up against my shoulders. Okay. Here, neck. Okay. Oh yeah. Okay. Okay. With the shoulder resistance performed, will the patient touch his ear to his shoulder? Okay, the other side. Okay, back. Okay, and touch your chin. Okay. So, neck, range motion, down, down, motion, chest. Okay, we will now begin. So, chest is symmetrical, respiration is normal, no respiratory distension noted, muscle tone is intact, skin shows no lesions. Okay, we will now begin auscultating for heart sounds. We will now begin auscultating for heart sounds over the patient's gown. Okay. We'll perform auscultation for bruits. Okay, no jugular vein distension noted. Okay. We'll percuss the patient's chest along the sternum. Dullness is noted across the bones. We'll now palpate the chest. Is this where we want to go? Okay. We'll now bring a chair for the patient to perform the abdominal assessment. Abdominal assessment. Okay, for the abdominal assessment, for the privacy of the patient, we will only reveal parts that are necessary for this assessment. Okay. Skin is intact. Symmetry is noted across the hips. Are you experiencing any distension in your abdomen? Okay, patient reports no distension across the abdomen, no pain noted. We will now auscultate for abdominal sounds across the abdomen, beginning at the right lower quadrant. Okay. We will now auscultate for bruits. Okay. Now we'll percuss the abdomen. Okay. And now we'll perform palpation. We will start with light palpation while moving to more palpation. So we'll begin with light palpation. Let me know if you have any pain or distortion so I will discontinue. We'll now move on to moderate palpation. And now deep palpation. Okay. Abdominal assessment is complete. Okay, we will now assess for femoral veins and the inguinal, and we will palpate for the inguinal nodes. The presence of the inguinal nodes are not there. Okay. Abdomen. Okay, so I think you stand back over.
Extremities.
Extremities, okay. So we could go out where. So this is where we're checking arms and legs. Okay. Okay, for this assessment, we'll be inspecting the patient's extremities from the shoulders, arms, hands to the lower extremities. So I will now palpate for the shoulder. I will now palpate the shoulders for any swelling and distension. Okay, we'll now move into the arms. Skin is moist, pink, no lesions noted. Okay, I am feeling for the epiloquial nodes. They're non-palpable. Brachial pulse is +2 on both arms. We'll now move on to the hand assessment. Okay, so we'll perform capillary refill on both arms. Less than 3 seconds noted. Okay, we will now, is it range of motion? Okay, range of motion for the right arm. Okay, no, left arm. Left arm. So, okay. So if you could test your coordination by touching your tips of the fingers. Okay, make a fist. Okay, I want you to move your hand down. Move it up. Inside, outside. Okay, now we're going to perform resistance against the hand. So if you could push against my hand. Okay, push up. And then push inside. Push outside. Okay. Now the same for the other arm. Okay, can you touch your coordination? Clench your fist. Okay, push against. Okay, push down. Okay, push inside. Okay, push outside. Okay. And okay, now we'll begin range of motion for the elbows. So if you could flex your arm, extend your arm. Okay, now we'll test resistance against the elbow. So if you could push against. Okay, if you could pull. Okay, now for the same for the other arm. Okay, so if you could flex, extend. Okay, now push against. Okay, now push towards. Okay, resistance complete. Now we'll perform range of motion for the shoulders. So if you could go up for forward, down, side, and inside. Okay. I need to do resistance on these. Okay. Okay, now we'll move on to the lower extremities. Okay, there we go. Okay, lower extremities. Okay, skin is intact. No edema, no edema, no swelling. Moisture, little moisture. Muscle tone is symmetrical across both legs. Lesion noted on the right side of the patient. We will now assess for the patient's popliteal pulse. It's +2. We will now assess the patient's ankle pulse, +2, and foot pulse, +2. Skin nail capillary on the toes is less than 3 seconds. Capillary refill is pink and flushed. Okay. Okay. So now we'll perform range of motion on the ankle joints. Okay, so if you could push down for me, push up for me, inside, outside, circle. Okay. Same for this leg. If you could push down for me, up for me, outside, inside, circle. Okay, now we'll put resistance against this joint. So we can push against. Okay, push up. Okay, push in. Okay, push out. Okay. Push down. Push up. Push in. Push out. Okay. So range of motion and resistance assessment done for the ankle joint. Now we will assess the joints of the knee. So if you could move your knee and extend. Okay, now bring it all the way in. Okay. Now for the next leg, can you extend? Okay, now bring it back in. Okay, so now we'll test resistance against the knees. So you could push against. Okay, now push in. Okay. Push against. Okay, now push in. Okay. Then you're done. Oh, what's after this? Hips. Okay. We'll now palpate for the hips to check for symmetry and muscle tone. Hips are symmetrical. Do you have any pain in your hips? No. No pain detected on the hips. This is neural now, right? Okay, we'll now perform the neural assessment. Look. We'll now perform the neural assessment. For this assessment, I will have the patient close his eyes, and I will touch the patient's face symmetrically and have the patient tell me if the feeling is symmetrical on both sides of the face. So now, do you feel that? Symmetrical. Okay, both sides?
Same.
Okay. Now we'll do it for the arms as well. Okay. Symmetry?
Same.
Okay. We'll now perform the 2-dot test, which 2-point or 1-point test. Okay. Can you tell me this is 2-point?
1 point.
Okay. 1 point? Can you tell me what this is?
1 point.
Okay. Again?
2 point.
Okay. And then done again on the other arm. Okay.
2 point.
Okay, good. Objects. I will now give the patient objects and have him identify the objects with his eyes closed using his senses. Okay, can you tell me what that is?
Chopstick.
Okay, can you tell me what this is?
Rock.
Okay, can you tell me what this is?
Stapler.
Okay. Patient was able to identify all objects using his senses. Okay, now I will have the patient open up his palm, and I will draw a figure on his. I will draw a number on his palm and have him identify which number I have drawn. So, can you tell me what that was?
8.
Okay. Now same on the other arm. Okay. Can you tell me what I drew?
7.
Okay. This first time, do it. So I do face. Yeah, this first time, do it. Okay. I will have the patient open his eyes up now, and he can stand up. We'll now perform a gait test. So if you could walk to the couch in a normal pace that you usually do. Okay, no gait detected. Coordination and balance. Okay. Now we'll perform tandem walking, which will require the patient to do heel to toe all across the floor. So we could do that. No gait detected. Coordination is intact. Okay. Now I'll perform the Romberg test. The patient will close his eyes, and I will monitor for 10 seconds if there is sway. So just stay still, position. Okay. Okay, Romberg test is complete. No sway detected. Okay, now I'll have the patient open his eyes, and I will inspect the patient's spine spine. So if you could turn to the side and I could palpate your spine. Okay. Spine is symmetrical. No lumps detected. No. Okay. Do you have any problems with your spine?
No.
Okay. Now can you bend forward for me? Okay. We'll continue assessing the spine. No curvature detected. Okay. Okay, I will now percuss the spine. Okay, do you feel any pain?
No.
Okay. Okay, you can stand up now. Okay. And that completes the head to toe assessment by Antonio Lopez. And I will also be palpating the lacrimal glands. I will now be performing a whisper test. So can you cover one side of the ear for me? Okay. 53.
53.
Okay, I will be performing it on the other side now. Elephant.
Elephant.
Okay, thank you very much. We'll now test the patient's coordination using finger to nose movements. So can you touch my finger with your finger and touch it back to your nose? Yes? Oh. Okay, now with the other hand.